Kylie. I'm going to be teaching you how to suction your trach. You first want to start off by washing your hands. After that, you would set the head of the bed up, which yours is already set up, so that's fine. Then you're going to assess the need to be suctioned and then assess for hyperoxygenation. So with that, you can look at your pulse ox, and if it's 92 or below, then you know you need to be suctioned. If you can visibly see secretions, if your chest feels heavy, if you feel short of breath or anything like that, then you know you need to be suctioned as well. After that, you are going to turn the oxygen on the wall up to 100. You're then going to take your tubing and you're going to hook it up to your suction on the wall. You're going to turn that 80 to 120. After that's all set up, then you can come over here and open up your kit. I'm going to throw these gloves out because I don't like to use them. So the first thing you're going to grab is your box. You want to make sure the plastic is on top. Keep that sterile or as clean as you can. You don't want to touch the inside of it. Then you're going to open up your saline. You want your palm to cover the label and make sure that the top of the bottle doesn't hit the box. Okay. Now is when you put your gloves on. And once again, you just want to keep these as clean as you can. Okay, and once you have these on, then you can reach in here and grab your tubing. I like to wrap this part up in my glove, that way I don't touch it on anything. Then you can dirty your left hand, attach it to your suctioning. Then you want to check and see if your tube is working and if the suction's working. So you're going to dip it in here, intermittently suction. It is working. So then you take your dirty hand, take the mask off, and then you're going to advance your tubing until you feel resistance or if the patient begins to cough. Then you're going to intermittently suction on the way back up, and you're going to put the mask back on. You're then going to clean the tube again, so suction. And then if you are continuing to have the same symptoms, you're going to suction again, so you'll take the mask back off again. Advance your tubing till the patient coughs. Okay, and then you come back up, intermittently suctioning. And then you are going to put the mask back on. If you are continuing to have symptoms after suctioning twice, then you need to call the healthcare provider. You then take your gloves off, you wash your hands, you're going to set your oxygen back to the prescribed rate, and then the suctioning as well. You're going to put that back to what the doctor sets it at.